Age of a fracture can be estimated by naked eye examination, histological examination in the blood. In the living, by radiological examination. Fracture healed in 4 stages. Stages of inflammation last up to 7 days, total 1 week. Stages of soft callous formation or reparative or proliferative phase, 1 week to 4 weeks. Total 3 weeks. Stages of hard callous formation or maturing or modeling phase, 4 to 12 weeks, 8 weeks. Stages of remodeling phase up to 2 years, rarely formation of false joint. Naked eye and histological examination. Stages of inflammation less than 7 days, being immediately after fracture, the last for about 7 days, 12 to 24 hours. Blood around the fractured ends of clot, 24-hour fibrin network around the fracture site formed, 2 days. Necrosis of the fractured end, histology demonstrated. Migration of polymorph into the necrotic tissue, 3 to 4 days. Migration of macrophages into the necrotic tissue, 7 days. New vessels begin to form and numerous fibroblasts are seen. Stages of soft callus formation, 1 to 4 weeks. Callus can be external outside the surface of the bone, intracortical between the fractured cortices, intramedullary within the medulla, characterized by formation of connective tissues, including cartilage, formation of new capillaries from pre-existing vessels, angiogenesis, which started in the previous phase, continues in this phase. Stages of hard callus formation, 4 to 12 weeks. Also known as a maturation or a modeling phase, characterized by laying down of a woven bone, characterized by also known as immature bone, earliest bone to be laid, and fibrils are randomly distributed bone mechanically weak. Because of this, contains a relatively high proportion of osteocytes laid down constitute a clinical union. Stages of remodeling, 12 weeks to 2 years. A plaster cast are now removed. Now woven bone is remodeled into strong lamellar bone by the orchestrated action of osteoclastic bone resorption and osteoblastic bone formation. Lamellar bone, mature bone, characterized by the regular arrangement of its lamella. Few osteocytes are present. They are evenly arranged and are present in the lacunae. Formation of small joints. Rarely there may be formation of false joints or a pseudoarthrosis, characterized by non-osseous union of bone due to inadequate immobilization, may take months to years to form. Radiological examination, rounding of fractured margins, 1 week. Subperiosteal newborn formation, less than 2 weeks. Soft callus formation can be seen as a very faint radiolucent mass like cartilage, 2 weeks. Calcified cartilage, 4 weeks. Fractured margin resorption, 4 to 5 weeks. Sclerosis of the fractured margin, 4 to 6 weeks. Bridging partial, 8 weeks. Decrease in the fractured gap, 8 weeks. Bridging complete in 10 weeks. Density of a callus equal to the surrounding cortex bone appears just like a bone hard callus, 10 weeks. Subperiosteal newborn formation in the cortex, 10 weeks. Remodeling, 12 weeks. Primary and secondary healing. Primary healing occurs when the bends of a fractured ends are closely opposite to each other. Fractures of the skull fracture are fractures release stabilized. Callus formation is minimal or absent. Lamellar bone is directly formed across the fractured leg. Type of healing is also known as osteonal healing. Secondary bone healing occurs when end of fractured are far apart. It involves the formation of callus, which ultimately replaced by bone. Complication of fractures, early ARDS, septic traumatic fever, compartment syndrome, rush syndrome, deep vein thrombosis, embolism, fat pulmonary injury to the joint, muscles, tendon and vessels. This is a shock. Late avascular necrosis, ischemic contracture, joint stiffness, myositis, ossificans, osteomyelitis, septicemia, pseudox, dystrophy, union defect, delayed malunion and non-union, Medico-legal importance, fracture are grievous at 320 IPC. Change ചെയ്തു. May cause injury to associated structures, vessels, bleeding, endanger life, may cause even death, nerves, deformity, loss of function. Time of assault can be calculated. Okay. Next is a fall from height. Fracture influencing the pattern of injury. Height surface smooth. Height surface smooth. Example, grass, sand, loose earth would cause less injury than hard cement floor. On orientation of body at a point of impact. The majority of falls vertical landing with the feet is the first common. Next common is landing on the head. Primary impact with the feet. Injuries occurs in following areas: head and neck. Ring fracture at the base of the skull, communicated fracture of the base of skull with associated injuries to the brainstem and inferior surface of the brain. Thoracic organs, aorta rupture at the junction of aortic arch with the descending aorta, thoracic aorta, intimal tear along the thoracic and abdominal aorta, rupture and laceration of the pulmonary tongue, arteries and veins and vena cava, superior vena cava, inferior vena cava. Abdominal organs, laceration of liver, spleen, pelvis fracture, vertebral column fracture and dislocation. Thank you.